I think it's Christian Fossum.
Okay.
Yeah. Christian is a guru right now in the osteopathic world because there are three Christians maybe. The first one is Christian Fossum for the vision, The vision of the salutogenic vision of the osteopathic treatment. So the role of osteopathy within the healthcare system, and it's really cool. The second one is Christian Chiranarab, that is a really close friend of mine, and it's in the pediatric field. He is one of the most renowned name in the osteopathic field across Europe. And the other one is Christian Lunghi, that is an Italian osteopath that is here
he's also
as well.
Part of our interviews.
Yeah, oh, great. Yeah, and he's conducting a lot of job within the osteopathic research in a salutogenic perspective as well. So the aim is to find the role of osteopathy within the healthcare system, and these three people are really cool about that. Yeah. The first one is stay tuned.
Yeah.
Because, at the beginning of the osteopathic path, I wasn't so tuned and so focused on osteopathy. Yeah. So the first one is stay tuned.
That's a good one. I totally see myself in you.
Yeah, it's true. I think it's really common among young osteopaths and young students.
You get more and more into it, you get more interested, and you think, shit, what would have happened if I would have done this like 5 years ago?
Yeah.
So that's why we ask this question.
Yeah, that is true. That is true. Yeah, it's my advices. Yeah. The second one is be more humble. At the beginning, I was just a little bit skeptic about, for example, cranial and fascial manipulation. But
I see you give myself.
Yeah, that's it. Yeah, because I don't trust. Yeah. I don't trust so much. But now I got a lot of elements that I can say that also in the cranial field and the fascial field. And I'm a fascial therapist, so I changed totally my point of view. And you have to be more humble, for sure.
Really interesting.
Yeah, and the third one is try to share more within the classroom, for example. Yeah. I remember that there was like groups in the classroom. Yeah. Like this group is more structural. The other one is more fascial. The other one is cranial.
And the other one is
students should be able to merge knowledge and to share knowledge. Yeah.
That's
much
really
more.
Really good point.
It's a question of experience as well, and formation and education. I think that every student should be able to create his own path and his own rationale to approach. And the private practice and the establishment of the practice is really an individual question. And the beautiful thing of osteopathy it's that there is no one osteopathy. Yeah, I think that it's really individually, and you have to try to manage your knowledge and try to create your personal decision-making process. Try to create your own style. Yeah, and be yourself, I would say. Yeah. In my private practice, I've got a collaboration with my wife that is a naturopath. So it's a merge of osteopathic pattern and naturopathic pattern, and the key point is differential diagnosis first. So you have to be sure and safe. So try to exclude red flags first, and you have to be able to do that really first. Important. Yeah. The second one is do and perform a great history taking. Okay, because if you are assessing and evaluating the data that you are gathering from the patient in a correct way, you have got a lot of information and more. So do a great history taking. And the second one, you have to be able to manage the time frame within the treatment. Yeah, because there are a lot of osteopathic guru that told you you have to treat within 15 days. Okay, my question is why? Because not in 10 or 7, because not in 1 month. So it depends on the patient needs. So try to be able to create a diagnosis and try to be able to establish a treatment plan, managing the patient.
And it differs so much.
Yeah, for sure, for sure. This is a key point, yeah. I was a cracker, we say in Italian, yeah. I was a crack at the beginning, you know, because I come from the sport, you know, so athletes, they like to be cracked, you know. Now I'm more, I like fascial manipulation, so I'm more soft, I'm more
subtle?
Yes, more subtle. You have to be more concentrated, you have to be more, you have to stay focused.
But do you still have a lot of athletic persons?
Yeah, for sure, of kids as well.
And it's the same outcome?
It's different. You know, if a person is an athlete, it doesn't mean that they need a crack. You know, maybe he needs, for example, a cranial manipulation or a fascial approach. And at the beginning, all the athletes I treated, crack. It's okay, no, just shape, you're in shape now, okay, good. It's again, it depends on the patient needs. So you have to try to skip your focus from this kind of manipulation to another related to the patient needs. Yeah. No,
also for a young audience, you know.
My perception is as osteopaths we work too much. Within the daily time, I mean. So at the beginning, I start like treating 20-25 patients per day. You know, that is really a huge amount. Like 30 minutes, 40 minutes for each. So, you know, it's amazing. Like, it lasts like 10 to 12 hours per day. So at the beginning it was crazy, Now I used to treat not more than 7-8 patients per day. So my advice is try to manage your time because you have to, if you want to be effective and do a good treatment, you have to be able to feel confident and comfortable with yourself. And if you are tired, you are not confident and comfortable with yourself. So. Yeah, I know. For me, osteopathy, it's not a profession, it's a way, it's a lifestyle, it's a way of being. Yeah, I like to see osteopathy like a philosophy more than a practice or a job, you know. So I used to say that I live osteopathically. Yeah, and it is related also to nutrition, to having rest as well, and I do meditation, for example. There are a lot of studies that demonstrated that meditation is really effective for autonomic nervous system balancing. So, you know, other advice is live osteopathically. Osteopathy is not a job, it's a philosophy.
So Alessio, thank you so much for
thank you.
being part of this.
Really?
Really interesting.
Yeah, really cool.